the top of the hour, so we have a pretty full agenda, so I'm going to go ahead and get started. Um, we have a great panel. They will introduce themselves shortly. My name is Sarah Levenletter. I am an Outreach and Education Coordinator for the NNLM Region 7, and I am the host, the MC. We're going to play this a little bit more as a discussion. So hopefully you will hear less from me and more from our participants in that way. So just real quick, we will be doing questions and comments in the chat. Please make sure that it's set to everyone so we can make sure that we're all seeing what you have to say. And closed captioning is available using the CC. If you don't see it on the panel of options on the bottom, it may be in the three dots more at the far right side. And then finally, this session is being recorded. We will share out the recording, I'm hoping within a week or two. We will also be sharing not the slides, but any resources that people put in chat. So if there's something that you like, if there's something that you use that you want to share, please feel free to put it in the chat and we will make sure that that is also included with the recording. So before we get to our panelists talking about graphic medicine and how they use it and how they've really brought it to their libraries and their communities, I'm going to do a very quick, very easy icebreaker. So I'm going to put 30 seconds on, and I will ask you all to close your eyes and draw a jack-o'-lantern, starting now. And that's 30. And that is just a very quick, very easy icebreaker. This is something that can be done cheaply, easily set up. Um, because it's a fun way to, uh, especially with adults who aren't encouraged to draw, sometimes they might feel a little bit uh, uh, self-conscious about drawing if they haven't done it a lot recently. So you end up with something a little fun and you don't worry so much about whether or not it's uh, technically proficient or, some of those other things that we worry about. So, now that we have sort of broken the ice, done a little drawing, um, our panelists are going to very quickly introduce themselves.
Hi, my name is Tatiana Saccio. I am a reference librarian and the collection manager for our nonfiction and adult graphic novel collection at the Nevins Library in Methuen, Massachusetts. Um, I have a really keen interest in health and wellness, and so I was really thrilled to come across graphic medicine and its creative approach to these topics. So I'm excited to be here with you today with Brittany and Dave and Sarah to introduce graphic medicine in the public libraries. Thank you.
Hi everyone, I'm Brittany Netherton. I'm the head of Knowledge and Learning Services at Darien Library in Connecticut, which is a fancy way of saying the reference department. And I'm in charge of our adult graphic novel collection. And I'm also the public library's liaison for the Graphic Medicine International Collective. So you can always ask me any questions that you have about graphic medicine in public libraries, whether it relates to this presentation or just anytime.
And my name's Dave Bartos. I'm the coordinator of adult services at Cranston Public Library in Cranston, Rhode Island. I'm responsible for collections, adult programming, and public services. The adult comics collection was given to me as a growth opportunity when I started 6 years ago, and I used particularly graphic medicine to as a subsection in there to advocate for adult graphic novels just as a thing, which has been really successful. And yeah, any questions I can try to answer, I'm happy to do it too. Thank you.
So like I said, we're hoping that this is going to be a little bit more of a conversation and a little bit less of me just asking questions. So we've sort of divided it into four sections. Getting started, collection development, uh, cataloging and promoting, and then programming. And so um, please feel free to throw any questions or comments in the chat, and we will make sure that those are asked and read. But this is sort of where we're starting. Um, how did you get started with graphic medicine in your library? What have been some of the strengths, and what have been some of the barriers?
I can go. So I inherited the adult graphic novels collection, about 2017, which was also around the time I was starting to become aware of graphic medicine. And at that time, one of our strategic goals in our strategic plan had a focus on providing information to the public about health. And
Mhm.
so it sort of just happened to fit exactly right at the right time. And so as I started taking over that collection, I started very intentionally collecting graphic medicine and learning more about it. Um, the strengths of including graphic medicine have been being able to promote comics to non-comics readers,
Mhm.
really being able to showcase comics in a way that is, that you don't hear them being shown. Most people are coming to that section because they are looking for a comic to read. But being able to say, like, oh, you like fiction that has family dramas and like generational stories, and here you might like this as well, and being able to sort of cross promote with fiction readers and nonfiction readers. And then the barriers that I encountered were just space. When I inherited this collection, it was on a single bookshelf um, in the cafe area with a table pressed up against it, like really not accessible at all. And it has relocated and expanded 3 times since 2017, and in part because of our graphic medicine collection.
Yeah, I can echo that. When I started, it was 8 shelves. It just mashed at the end of fiction, like, here. And,
Yeah.
now it's 5 ranges and it's just so beautiful. The whole collection has unfortunately plateaued. And it's like, based on statistics, like search statistics, it's like, yeah, this is the biggest it needs to be, which means I can't just keep buying and buying and buying, unfortunately. Yeah, I had a lot of similarities to what you said, Brittany. I got started because I was asked to develop the graphic novel collection and just looking for different ways to think about the collection, not just as like, I mean, if it was up to my director, and this is not a dig, but it would be all Silver Age, Golden Age comics and just like beautiful. And there's so much more going on and so much more that words and pictures can tell in stories. And so it was some intentional um, collecting and getting some grants. And we got a grant from the NNLM to purchase some books for the collection. We have a yearly grant gift that, I made a request to purchase specifically in the graphic medicine, and to kind of say that comics aren't just for people who want to read comics, just like you said. And when we put a display together that's Health Literacy Month, in addition to nonfiction books, we have some of the graphic medicine books there too. And so it's just a broader part of the collection to bring people into comics who wouldn't otherwise have picked up a comic book. Is the biggest one.
Yeah. I got into graphic novels when I came to this library, just developing the collection first 15 years ago, and then It wasn't until about 5 years ago when I was taking the consumer health information specialist classes that I became familiar with graphic medicine. And in particular, I remember watching a webinar that Brittany had put out about her book club kits of graphic medicine topics, and that really inspired me. So since then, I've been actively collecting graphic medicine and was able to develop my own kind of graphic medicine kit to really focus in, especially on mental health issues, because I think
Mm,
this medium is such a boon to have because the visual images, they can be kind of take uncomfortable subjects and make them more palatable and understandable. And it's also great for people whose native language is not English for understanding what's going on. It can draw them in. So I appreciate that as well from graphic medicine. And my strengths and weaknesses are pretty much the same thing. It's budget and space.
mhm.
And we've gone through a couple of different spaces as we've grown in the collection. Um, my colleagues here have been very helpful in carving out space for me to grow the collection. Um, and we did get a collection development grant from the NNML Region 7. So that has pretty much doubled or tripled our graphic medicine collection.
That's great.
Yeah.
So then I did want to say that there was, Tatiana, we had talked about the positive feedback that you had received from your
Yes.
patron as well.
Yes, this was incredible, and I did not pay the patron. I actually don't even know who it was, but they couldn't have said it like this went straight to my heart. Because sometimes we put things out and we don't know how they're being received.
Mhm.
But this woman actually wrote a note to me, saying that the graphic medicine series was so creative and phenomenal, and as a therapist, you could see the value of it and contributions to destigmatize mental health challenges.
Mm.
And as a person overcoming mental illness, she said that those kits really made her feel less alone and supported. And she was able to be a better mom
Mm.
with the help of these kits.
Wow, that is
So,
really powerful.
That's fantastic.
yep, I feel like I can retire now and walk off.
Yeah, one of the funnest for me when I put out just a display of like this is the graphic medicine collection, and I looked over to the display and there was a man in scrubs sitting there looking at them, and I just wanted to be like, I put those there for you, just for you. It was pretty cool.
So I'm going to move on to our next section. Again, feel free to throw any questions in the chat. Don't feel like you have to wait for uh, the topic to come up. And also any comments if this is something that you're doing and you're seeing something similar or you had a completely different experience, please feel free to share that in the comments as well. So, we talked a little bit about collection development, the money, the space, but how do you go about finding the titles to include? And then how do you determine sort of the health needs of your community to sort of then determine the topics, then the titles that you are looking for?
So, for finding titles to include, it's a mix for me. I'm in the graphic medicine group on Facebook, which I highly recommend. It is a great hive mind to bounce things off of. You'll find out about graphic medicine programming there. People share about various books that are coming out. There are certain publishers that are starting to publish graphic medicine very intentionally. There's Graphic Mundi, there's Pennsylvania State University Press. I'm sure Dave and Tatiana and Sarah can name some others that may not be in my brain right now. I have a lot of luck going actually to conventions, comic conventions.
Mm.
Mm.
So local to me is New York Comic Con, which is coming up in a few days. Just walking around the floor and seeing, what what artists have out. You find a lot of graphic medicine that way. Unfortunately, some of the time it's, zine format or something that's kind of hard to collect in a public library. But I had really good luck recently, last year, at the Nonfiction Comics Festival in Vermont, which is a free thing at the Vermont Public Library, the Burlington Public Library. And just walking around, there was so much graphic medicine on the floor and stuff that wouldn't have shown up in, like a typical collection discovery, like Baker and Taylor or Ingram or something like that. Following people on social media, other graphic medicine librarians and educators and creators. And then for determining the health needs of your community, I have to give a plug to looking up your community health needs assessment. So your community probably has one. They do it every X number of years. And it is just a treasure trove, not just for graphic medicine purposes, but for library purposes in general. If you're not familiar with those, they will tell you things like what are the prevalent health issues in your community? What are the most common reasons that people are hospitalized? What is the age breakdown of your community? It gives economic information, social information. I was just recently looking back at ours. Our most recent one is 2022. And it even gets as granular as like what percentage of people in your community feel safe walking alone at night. And so it's useful for any number of reasons, but if you are wanting to get into graphic medicine and you just want to put a little bit of money into it to see how it goes, I think that assessment is a really good way to see what sorts of topics you should prioritize.
Yeah, I second Brittany on that. That was very helpful for me when I consulted with my community health needs assessments. And I've been noticing a trend now in terms of where you can get reviews. Some of the standard selection journals that I use for buying nonfiction, such as Publishers Weekly, Libraries Journal book lists, they're having more and more articles specifically on graphic medicine. So that's been a very exciting thing to see it really get more mainstream attention. And then also within the regular graphic novel reviews, you can kind of pick out those that would probably qualify as graphic medicine.
Mhm. Yeah, I'm just going to jump in on everything that
No,
you both
please.
said because those are the things that I do too. I know that I'm really bad at reading review journals, but Booklist does the guide to graphic novels every year. And Matthew No is, speaking of
Yeah.
people to pay attention to, has an article here about zines or not. You've got what in your graphic medicine collection? So again, I think it requires a little more almost like turning over rocks, right? Looking in the places where we don't normally look for things, with that intention again. And and I think also for me personally, like buying books that don't have the amount of reviews or literature about them as it kind of is in our collection development policies and procedures, but because we're going at this kind of a non-traditional sort of subsegment of a collection, just being taking those kinds of risks on things because they're obviously good, and if you can find something written up or people talking about them that you trust, to definitely go with that.
So I want to give a shout out to graphicmedicine.org as well for folks who don't know or may not be familiar with that resource. They do, as the name suggests, completely graphic medicine focused, but they do reviews as well as podcasts and, some programming things and other ways to get involved with the community, and then also other ways to find resources. Let's check my notes real quick. Dave, we talked about leveraging community partnerships as well as a way to learn about what health needs are going on.
Yes. Yeah, here in Cranston, we have the one Cranston Health Equity Zone, and they're through the Comprehensive Community Action Program, CCAP, and they are providing, oh gosh, I always forget all four of their pillars, but they have they have like built environment is one thing, the environment of the city, nutrition, youth advocacy group, bother. And there's definitely one more, and they're great community partners that have connected me with the kind of health information seeking public specifically. So it's not just, well, gosh, I'm going to get this stuff. I hope people come into the library and use it, which is a lot of what we do generally anyways. But being able to say, hey, I've got all this stuff, give it to your people. They have a mobile clinic that they drive around town and set up. So it's like a bookmobile, but for getting your vaccines. That's where I get my vaccines, which is great. And so, just making friends with those partners and letting them know what we have that they want for sure.
I think also paying attention to what people are already asking for at
Mm,
your library.
Yeah.
So like, what topics are they asking for at the reference desk, or
Mhm.
paying attention to your circ data, which nonfiction books
mhm.
in those sorts of areas are tending to check out. Or even for fiction readers, like I said earlier, like what sorts of topics are in the fiction books that are really, really popular in your community? And is there a way that you can take that and do sort of like a read alike sort of thing? All of the information that you already have is useful in this situation as well.
I'm still, yep, still no questions in the chat yet. So if there's anything that's popping out at you, please feel free to comment or ask, and we will move on to our next topic area, which is how do you have your graphic medicine titles shelved, and what strategies do you use to help people find these titles?
Yeah. Ours are just interfiled but interfiled with the graphic novel collection, and the graphic novels are, there's fiction. We've got a whole flow chart that things go through for fiction, whether it's shelved by series or by author. It's kind of a moving target. Our catalogers do a wonderful job with that. And then a nonfiction in Dewey range collection, and that's where the bulk of it ends up being. Um, so it's kind of interfiled with the rest of the collection. We do have book lists created, paper book lists, as well as something on our catalog to to highlight where these are existing. And then of course pulling them out into displays, either saying here is graphic medicine, or putting some graphic medicine in places where it's appropriate. So if it's memoir and we're talking about memoir, putting some graphic medicine that are more memoir out there, and then slip the book list in there. Maybe somebody will get find something interesting, and just sort of put it in people's way like that.
Similar for us. Our adult graphic novel collection is its own collection. The graphic medicine titles are interfiled there. I have our graphic novel collection organized by just fiction, and then we actually have memoirs, bios, and autobios separated out because that tends to be a very popular type of book in our library. So we're sort of capitalizing on that. And then we have nonfiction as well. Uh, there are some titles where I might buy two copies and put one in the general nonfiction collection as
Ooh.
well. So I know some of our graphic medicine titles on Alzheimer's are actually with the Alzheimer's books, just because discovery, we know that people are going to that section a lot. We have an aging population here in town, and so we want them to be able to find that book, and they won't find it in the comics. We don't do paper book lists, but we do have a book list on the website, which I'll pop into the chat. I manage this book list, and anytime a new comic comes in that would fall into graphic medicine, I add it to this list. So it is forever being updated. And I also utilize a note feature on Aspen to be able to just specify what topics each book covers because it's not always clear just based on the cover or the blurb. I will say one of the pro tips that I have for you is that you probably notice if you already collect graphic medicine or graphic novels at all, that the catalog records are not always great. They don't always have subjects listed. So I actually, speaking of Matthew No, again, rely really heavily on Hollis, which is Harvard Library's catalog. I end up looking, if I can't immediately figure out on my own what topic a book is covering, or if I'm not sure I'm getting all of them, I will look it up in Hollis because their catalog records tend to be very thorough. So just a plug to the cataloging team over at Harvard doing amazing work that I use all the time.
Yeah. We have a similar setup to Dave and Brittany's collection in terms of our graphic novels or adult graphic novels, or in one particular section with the graphic medicine titles being interfiled with the regular graphic novels, fiction and nonfiction and memoir. The only thing that's a little different is that I have these specialized kits. They're a combination of about 2 to 4 graphic novels on a particular mental or physical health issue. And they're combined with consumer health information. They're in a media hanging bag. And I have those face out for display. So those kind of are in your face a little if you go into that section. But otherwise, I or some of my colleagues will sneak in graphic medicine titles for all the other displays that we have up at the library, as Dave was saying earlier.
So this question didn't make it on to the slide, but it's something that we talked about. I think Dave especially mentioned it. Weeding and maintaining the collection. Any thoughts on that?
Yeah, it's definitely, again, speaking of to the intention, I don't want to weed these titles that probably don't get as high circ as other things, and they have a different meaning than just, like a collection of weekly comics that has passed its prime. Nobody's reading. I don't want to shout out any particular comic, but they're on my. I keep them. They become my personal collection, which are just my weeded comics that I don't want to get rid of. But these fulfill a different purpose, so I do think about them more like a nonfiction book that fits in the collection for a particular reason. And I'm not going to weed it because it fills a gap in the collection and what we're trying to do. So just making sure not to go by circulation statistics as much. They won't, in my experience, they're not as quote unquote high, high volume, but that's because they're not supposed to be. It's like travel books. Like not everyone's going to check out Travel to Ethiopia, but we have the latest Travel to Ethiopia book because somebody will. So something along those lines. Yeah, and then with that, just making sure everyone knows so that no one touches your books. like don't weed my books, which doesn't happen.
I have a cart in the basement of the ones that came up
Yeah.
for weed that I was like, I feel like we do still need to have these, but
Right.
I physically cannot leave them on the shelf because I'm out of space and the shelvers are begging me to do something about it. So I have a big purple cart in the basement that has all of the graphic novels that technically qualify to be weeded. But the same as you, Dave, I feel
Yeah.
like these are important to have around for the person who does need them.
Right.
Yeah.
I pretty much feel the same way. There's this tug of war between you. I think you should still maybe keep this on hand, but you need that space, so you kind of put it elsewhere.
Yeah. And I will say,
Yeah.
I don't get precious about library books. I am a weeder through and through. If it's
Hmm.
not circing, I am ready to let it go. But with this collection,
Mm.
I do feel that way that like, no, this is filling a gap. And like any nonfiction book, like we wouldn't weed the last copy of something that is the only book on that topic.
Right.
And so they have their own little special policy in my brain.
Yeah,
Well, and that
definitely.
goes back to when you were talking about how you know what topics to focus on. Like you have your justification right there because you've done your research of, we have an aging population, so we definitely need more stuff on Alzheimer's, dementia, falls, you name it. And so, you got your justification right there.
Right.
So in the chat from Amanda, so many go out of print. It's hard to be willing to get rid of them since we can't just
Mm.
repurchase them whenever we want as
Yeah,
well.
Yes,
that's
absolutely.
true.
So now the sort of fun one, I think. You got your collection, you got it set up. What have you done with the collection now that you've built it? How have those programs gone? What would you do differently if people uh, are in sort of various different places in their sort of graphic medicine journey? What are some of the things you would tell them to help them along?
While the traveling exhibits were still a thing, through the National Library of Medicine, which RIP, I found out they're pausing the program. But we were hosts to the graphic medicine traveling exhibit where they had 6 large panels introducing folks to graphic medicine with the artist Ellen Fournet and her seminal book Marbles
Mhm.
on bipolar um, disorder. And while we had that display up for a few months, we also had some programming around it. We had a gentleman come speak about graphic medicine. We had a graphic journaling workshop where everybody had like a blank journal and they were instructed to express themselves artistically. And I think the other thing that I quite enjoyed was that we had I guess it was a passive activity. We're up near the exhibit panels. I put a easel with a big white blank pad of paper and just wrote on it, draw out how you're feeling today, and I would do my own little stick figure representations of how I was feeling. And people would come by and they'd just do their own little doodles. And that was fascinating. Um, they had pages and pages full of people doodling how they were feeling and how the weather was affecting them that day. So I thought that was a passive, very easy activity to have.
So there's some good stuff happening in the chat that I don't want to miss before we continue with this conversation. There's some questions about academic health science libraries and comics. Uh, Let me read this specifically. I was wondering of comic and graphic novels about women's reproductive rights and how to navigate political motivated conversations regarding the acquisition of such materials. Um, and so I think there's sort of two things there. There's the public library aspect, and then there's also the academic aspect. And I
Mhm.
think one of the things is so I'm in Region 7, and our panelists are all from the Region 7 Graphic Medicine Community of Interest. So if you are in Region 7, we have a great network that talks about these things together. If you are not in Region 7, I would still recommend reaching out because we may know somebody in your region who can talk that through with you directly. So I will say that first, and then I will throw it to you guys if you have any other thoughts on navigating some of the stuff that's been going on.
Mhm.
I mean, what I find helpful, and this is just more broadly for the whole, like, book challenging ecosystem that we're unfortunately living with right now. The most important thing is that I don't think any frontline desk staff should be having conversations about this. They should just say, "Oh, I'm sorry you don't like that book. Here's a request to reconsider form. It's a front and back 2-page book report. You're welcome to fill this out, sign it, and I'll give it to my director. And, I value your input." Smile. Um, so that's how we respond with every single book that anyone comes up to us and has a problem with. From my understanding, in the entire time my director has been in that role, we have received exactly 2 signed um, requests to reconsider forms back, and at least one of them was because President Obama at the time was on the cover of Rolling Stone. So he just happens to be on the cover of Rolling Stone. And so it's like at the desk is not the place to have those conversations. And speaking as a collection development librarian, I do take very seriously my community's input in the collection. I'm being very glib right now because I'm a very glib person, but um, I earnestly want their feedback. I'm spending $28,000 a year on books, and I don't read all the books that I purchase, obviously. But there's a process, and if they're willing and able to engage in the process, I'm willing to invite them into that. So if somebody's just, well, I don't think there should be books about women's reproductive rights. It's like, okay, like here's how you can let us know that. Like just talking to me is not the way, but here's how you can let the library as an institution know that. And that's, I think, the best way to approach that. And I'm of course speaking from a public library standpoint. So if that's different than an academic library, uh, I'm willing to accept that I don't know what I don't know.
So on a different note, in sort of the opposite direction of people thinking that graphic means something more than it does. Um, Katie said we had a problem in the past with program participants because patrons thought the graphic part meant R-rated. And have you ever encountered this, and how did you navigate that, or how did you prevent that misunderstanding from happening? Um, and Hannah said that I've seen the same thing with adult graphic novels.
Mhm.
Sometimes the terminology really throws people off.
Yes. I have noticed that. And I promote mine really frequently as graphic memoirs. And then every once in a while, you'll see the person's face like, "Huh? What?" Um, I was Googling over here trying to find it, and I can't. Sarah, you might know about it. There used to be a flyer that you could print off that was like, what is um, I think it was What is Graphic Medicine, but maybe I'm wrong and it was graphic novels. But it was a very sort of like cute, brief, explanatory comic about what is this? Does this ring a bell, Sarah?
It's the How to Read a Comic
Yeah.
Yes.
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 Um, and so I often would put that out whenever I first started promoting the adult graphic novels and the graphic medicine collection. I would often put that flyer out in addition so that it sort of visually tuned them into what the graphic part of it is. Um, I have before just made sort of like Xerox copies of various pages out of some of the graphic medicine titles and had that on displays with the books so that again, like I rely pretty heavily on just visually showing people that's not what this word means. I want to believe that most people do not make that association.
Hmm.
But it reminds me of a situation I heard of where genderqueer was on a display and someone accused a library of putting out child pornography, which is just a fundamental lack of understanding of what child pornography is. Um, and I think most people are not like that person. But you trying to find another way around it. I rely on visuals, but I think some of the suggestions about maybe calling it health comics or medical comics, if you're with a population where comics is not sort of like a taboo word to use, that could work, I think.
So we actually have Jason chiming in saying that he thinks it is a common issue. Graphic is a huge problem in our academic library. We've had people get offended at the word because they have previously only used it in a negative manner. So
I
that
think
is a
leaning on comics instead,
Yeah.
good. Um, Calling them something else entirely. Here are books about navigating cancer. Here
Mhm.
are books about mental health. Um, I'm always a big fan also of just calling them books because
Yeah.
it sort of like fights that stigma.
Right. Sequential art. We could do
Sequential
that.
art.
Yeah.
um, I do want to go back to the conversation about programming, and I
Mm.
do want to specifically single Dave out and the HES programming with the
Yes.
Alzheimer's title.
That's only because it was such an uncomfortable experience, but I learned a lot from it, which is nice. So yeah, our local has we planned a pop-up graphic novel book group. I had a graphic novel book group just generally for a few years, but did have to end it for low attendance, and we did a couple of graphic medicine titles in the process of doing that in just a monthly book group, and that was very nice. We partnered with the HES and we had someone from the Alzheimer's Association also come out and we read Can't We Talk About Something More Pleasant by Roz Chast. Um, I think it was a snowball of little events like the person who arrived from the Alzheimer's Association had a different program in mind because there was another program happening with the Alzheimer's Association. So she wasn't really prepared for the conversation necessarily. My hope being that somebody who read the book that is also qualified and able to speak to some of the themes that come out in the book because I'm certainly not. I'm a public librarian. I used to work at Starbucks, right? Like it's not my specialty. I'm a generalist, but um and it was a combination of that and just everybody getting into some really deep and heavy conversations about how the themes of the book impacted their own lives that it really kind of turned into a grief counseling workshop instead of a book group. And as a result, I was definitely like, everyone's having a really nice conversation, but I am woefully under skilled to be the person doing this. So that's certainly something that I came away thinking like, well, make sure that the person who's coming to be the expert in the room, make sure they know what they're doing as the expert in the room. Um, is a big one. And I think broadly speaking with some of these, I think I could see that happening with a lot of these topics, that it is a very personal and heavy topic, health information and health, someone's personal health story as told through a memoir. That just being prepared for that and then making sure you're prepared for that is a big help. It was a good conversation. Everyone had a wonderful time, but I definitely left it like, oh. Yeah, I'd do it again though. I'm not gonna lie.
So what I'm hearing is be prepared for it to get too heavy.
Yes, definitely.
Put some supports in place and maybe have a pre-meeting with sort of the hosts or
And unfortunately, we
co-hosts.
kind of did all of those things, and yet I still think it didn't quite have the support it needed. But yes, definitely. Um, and everyone had a lot of things they needed to talk about. It was great.
So then, I wanted to also mention, Tatiana, there was some discussion of sort of program adjacent programming.
Mm.
Um, when we talked as a group, you talked about like zine making and other things as not necessarily graphic medicine, but this like adjacent programming that would be useful.
Yeah, yeah, we did like a graphic journaling program. And that was kind of in the ballpark, maybe, of graphic medicine. Mm.
So I think one of the things why we did that sort of 30-second draw um, exercise at the beginning is, the more we get people drawing, it helps them with their visual literacy. What do we
Mhm.
include? How do we communicate that way? So some of these sort of not health specific graphic medicine things, but some of the um, sort of adjacent programming around comics, around getting people to draw and think about, okay, how are you going to communicate? What are you going to
Mhm.
include? So to think about some of that programming as well, that, isn't necessarily specifically graphic medicine, but
Mhm.
is related and is related to how we um, process and learn with comics as well. So we have
Oh, yeah.
So we still have about 10 minutes. There have been some great LibGuides shared in the chat if folks are looking for additional resources. I will also be saving the chat and will include the links that people have shared through that. But we also still have plenty of time for more questions or discussions if there are other things that people want to share or ask about. Um, And then we also have, you know, I did not put my contact information on this. I said, you can reach out to me and I can help you get in touch with my network. I will put that in the chat. But this is contact information for our presenters, and they also provided a uh, graphic medicine title that is their current favorite. I would never ask anybody to pick a favorite forever, but these are their
Really,
recommendations for.
Might Lightning, I think, would be hard to unseat for me. It is
Mm.
my favorite, and it is also the one I cannot recommend to people. I have
Hmm.
never once recommended this book to anybody because it is the saddest book that I've ever read, and I cried the entire way through, and I had to read it over the course of multiple weeks because I would read a page and then have to put it down and walk away.
Hmm.
Hard to recommend it, but it is not because it's not good.
Um, Great question in the chat. We talked a lot about adult graphic medicine and adult graphic novels, and I know that's partially because of that where your focus is. But um, what about for kids?
Yes, and I actually had on in my notes to mention this and then totally spaced on it. So we're talking a lot about adult comics, but there's graphic medicine for children and for teens. Think the first person that comes to mind for children for me is Raina Telgemeier. Excellent, excellent graphic medicine from her. It is not my area of expertise. I do periodically, if it comes across my radar, I will throw it onto my graphic medicine book list. But does anybody else have like other? Oh, I know for teens, Lighter Than My Shadow. I think
Hmm.
that typically is considered YA.
Yeah.
Go with
Go
the
with the
Flow,
flow.
fantastic one.
Jarek Krasaska, Hey Kiddo,
Yes.
Oh,
dealing with
yeah.
parental substance use. Um, yeah, they're definitely out there. Laurie Halse Anderson Speak is a really good graphic novel adaptation.
Mhm.
And with children's collections, I think there's a conversation to be had about like picture books as
Hmm.
well, and whether some picture books sort of skew into sequential art
Hmm.
territory. I tend to be of the mind that, yep, we should count those. Some people are purists.
So we've gotten a couple other suggestions in the chat. The MediKid series. Hannah says we used a lot when I worked at a children's hospital, but they're harder to obtain now. Let's talk about it. El Defo, allergic, chicken pox, and then from Lisha, there's a lot. There are a lot of manga titles that double as medical comics as
Hmm.
well. Cells at
Yep.
Work, Full Metal Alchemist. Um,
And I will plug too, when we talk about graphic medicine, we tend to veer away from superhero comics, but there
Mm.
are plenty of superhero comics that are also dealing with graphic medicine.
Yeah.
So it
Mhm.
is possible if you have a collection that is heavy DC, Marvel, that you already have graphic medicine in that collection as well.
Yeah. Yeah, one that we had previous to this collecting or this focus for me, that I put in our graphic medicine collection is Captain America: Truth, which is about a black Captain America, and it's basically the Tuskegee experiments, but
Mm.
told from the point of view of Captain America, which is really, really fascinating, and it's impactful, but it's also a superhero comic. So something to kind of like, again, sneak a little bit of vegetables in. I mean, I don't really ascribe to that. I think all books are good books. We're just saying read some good books, but yeah, that's one that I can suggest.
there's a shout out for Deadpool and Venom comics,
Mm,
in particular that deal a lot with mental health as
Mm.
well. Um, I will also just put in the plug that um, you may have things in your collection already that
yeah.
are graphic medicine that you haven't thought about. And I especially with the kids ones, kids comics rely heavily on stories of social, emotional growth, puberty, bullying, dealing with siblings, and all of that would definitely potentially qualify as graphic medicine, depending on
Hmm.
how you are presenting it, how are you using it, what themes you're pulling out and discussing, things like that. So I actually had a question that came up in a presentation that I did 2 weeks ago that I want to put to you.
Mm,
And it is about graphic medicine and comics in general in ebook form.
mm.
Oh.
Um, so any thoughts on that in terms of are you starting to include that in your collection or um, anything in that realm?
Um, I hope that sorry, I was reading Kathy's comment at the same time that you were talking, and I might have misunderstood. But we subscribe to Comics Plus, which
Oh.
is a great sort of digital resource for titles, especially backlist titles. Um, and we have Hoopla, and there's a great comics collection on Hoopla. The thing that I run into with Libby is that the books that are in comic format can only be read on Kindle. Uh,
Mm.
I mean, this is going to be the case on Hoopla as well and Comics Plus. But I don't know. I we don't buy them intentionally on Libby for that reason, and because I don't think they would circ as well considering the cost. But we do utilize Hoopla and Comics Plus as a way to have that digital collection that has a lot of graphic medicine titles without us having to do selection and worry about buying a metered access title that's gonna circ one time and then not do anything.
Yeah,
So,
yeah. I'm in Rhode Island. All of our libraries are connected. Ocean State Libraries, we have a single library network, and all of the ebook purchasing happens at that network level. So that's a team approach. I don't think there's a lot of comics on there. I am sure if I was to say, "Hey, can we buy these things?" they would be happy to, but also
Mm.
they have so much to buy in terms of just fulfilling patron holds for bestsellers, that I don't see at this point a reason yet, I guess I would say. It doesn't given all of the limitations, and I personally don't like reading comics on a screen. I know I hear a lot of complaints that, like everything's too small because the size of the screen and you have to zoom in on things. That I haven't heard anyone asking where are all the comics on ebook is what I would say. It's talking about listening to our patrons.
Yeah, I think we rely on Hoopla more for
Mhm.
that. Um, I have not heard any requests to get comics online to Libby.
Mhm.
Yeah.
And of course, the challenge with Hoopla is that since we're not in control of those collections, they can purchase and remove things kind of at will. So, you can say, "Oh, we have it," and then you just don't. It's kind of a bummer.
So we're about 5 minutes from time. There is one question in the chat if folks have thoughts, um, specifically on recommendations for children and grief. And while you are thinking about that, I will put a plug in. There is an evaluation link in the chat as well. We really rely on your feedback through the evaluation, to figure out, what we are presenting on, how we're doing, things like that. So, although there are no CEs for this particular presentation, we still very much value your feedback on everything.
So, children's graphic medicine is not in my wheelhouse, but I did find a link that I just put in the chat from another library. It's a staff created list from Portland Public Library that contains children's fiction and graphic novels depicting young people navigating the wide spectrum of loss and grief. So maybe that could be a good starting point.
Hmm.
I wish I could like recommend any of these, but I have not read them.
So maybe what I'm hearing is our next presentation needs to be focused on kids,
That's a
graphic
great
medicine.
idea. Yes.
Okay, so again, thank you all for joining us. If there are any questions, feel free to reach out to me. I'm always happy to connect folks to any of the resources that I know of. I will also be pulling from the chat, so all of the great links that folks dropped there will go along with the recording when it is sent out. And, feel free to um, reach out. There is no CE for today's course, and the link does not work. I'm not a fan of that. Um, Sarah, try copying the link and to a browser. Unfortunately, the long links sometimes do and sometimes don't automatically open.
Thank you, everyone.
Yes, thank you.
Thank you.
Sarah, feel free to reach out because we do want to hear from you. So if you send me an email, we can figure out how to get you linked up to the evaluation. Yes. All right. Okay. There.
Oh, Sarah, was it a different link that you said wasn't working?
I'm going to stop recording. We can.
Oh, okay, all good.
Good. Okay.
Oh, good.
Stop sharing.